Um, I'm gonna check my physician's prescription and orders, and everything's looking good to go. I'm gonna wash my hands, or I'm gonna use the antibacterial foam. I'm gonna introduce myself. Hey, my name is Destin. I'll be your student nurse taking care of you today. And I'll ask the client to state their name and date of birth out loud as I'm checking their armband. And once all that matches up, then I'm going to provide for privacy. And then I'm going to explain to the patient what I'm going to be doing. Today we're going to go ahead and start you off doing an orientation and pupillary assessment on you. And then I'm going to administer your eye drops in your left eye that the doctor prescribed to you. And then we're going to check out the lower half of you, doing your lower extremities. And then we're going to do a sterile dressing change. We're going to start by doing 2 assessments, and that's going to be orientation and pupillary assessment. I'm going to begin by asking my client to state her full name.
Alexa Edwards.
Okay, and do you know what month it is?
October.
Okay, and do you know where you're at?
St. Dominic's.
Okay, the patient is alert and reactive and knows what's going on. I'm going to start the eye assessment by checking out the shape, symmetry, and size of her eyes, and everything looks okay. Everything's good. Next, I'm going to begin by doing testing the eyes to the reaction of light. And if you would, please look at the poster. And I'm going to shine the light in both of her eyes. Now I'm going to do the opposite eye. Both of her eyes did constrict, and they both had a consensual response. Next, I'm going to test for accommodation. I'm going to place my pen light 5 to 15 centimeters away from Miss Autumn's eyes. And I'm going to ask her to follow, just go ahead and follow the pen light all the way to the bridge of your nose. Alright, and her eyes did get small, so constriction and they both converge, so that is normal. Now I will begin my lower extremity assessment, and I'm going to start by going ahead and pulling the covers back. Alright, and I'm going to go ahead and I'm going to pull your pants up. I'm going to inspect both of her legs for the color, the edema, for any swelling, any lesions that she might have on her legs, and symmetry. And they look equal and everything looks good. Now I'm going to palpate both of her legs with the back of my hands, testing for temperature. And everything is normal. Next is going to be capillary refills, and I'm going to do that by pressing the tips of her toes, of her big toe. And each toe returns to the normal color within less than 3 seconds, so that's normal. Next, I will locate and grade both of her pulse points on her feet, and this is the dorsalis pedis. I've located it, and I would probably rate that or grade that a 1+, and that's pretty typical, seeing that it's it's one of the pulse points that's further away from the heart. And then I'm going to locate the posterior tibial. Okay, I have located that, and I would also grade that a 1+. Next, I'm going to go ahead and test my patient's muscle strength, and I'm going to do that by doing dorsiflexion and plantar flexion. So, Miss Autumn, if you'll go ahead and you'll pull your toes closer to your head, okay, and go ahead and push against my hands. All right, and I would say that my patient's muscle strength is pretty equal, and it's within normal range. The next phase of this would be medication administration. My patient was prescribed Timoptic 0.5%, which is one drop in her left eye daily. The generic name for Timoptic is Timolol. Timolol is used to treat ocular hypertension and glaucoma of the eyes. And it is also a beta blocker. Some contingencies against this medication that I would need to check before administering is heart rate and blood pressure. I went ahead and checked both of those. Both of my patients' vitals that I needed to check were within normal range. I've verbally asked her if she had any allergies. There were none. And then I have 3 checks to do with my medication, and I've already done 2 of them. First, I checked my medication to my physician's orders. Then I checked my medication to my MAR. And the last thing I'm going to do is I'm going to ask my client or my patient to state her first and last name and date of birth. And then I'm going to check my medication to the client. The client and the medication are both right. So now I can begin medication administration. First, I would ask my client to look up, and I would hold open her lower eyelid, and I would apply 1 drop to her left eye, to the lower conjunctival sac, and then after applying 1 drop to the lower conjunctival sac, I would close her eye, and I would press firmly on her nasolacrimal duct for 30 seconds. The reason why I did that is to prevent any medicine that might roll down her face or stream down her face and go into any other systems. Good afternoon, Miss Adams. We're going to go ahead and we're going to change that sterile dressing that we talked about earlier. I'm going to go ahead and I'm going to raise the bed to a comfortable working position for my back. So, raise you up. Go ahead and place my table. I'm going to go ahead and I'm going to put on clean gloves. Position my biohazard bag. And I'm going to go ahead and I'm going to peel back the covers. And I'm going to reveal the wound, the dressing. And I'm going to go ahead and I'm going to start by lifting the tape up around the edges. Just going to go along the perimeter of the dressing. Whenever I'm taking this off, I'm going to be careful not to lift it to where my patient can see it. It could cause them to kind of pass out or kind of get a weak stomach. So as I'm done lifting the tape, I'm going to go ahead and I'm going to lift. Well, I know this would be considered contamination, but typically these gauze bandages, they do not stick to the tape. So there's one of them, and I'm lifting it, and I'm going to look right here, and I'm going to dispose of the dressing in my biohazard bag. Technically there would be 2 gauzes here, so I would lift both of those, and as I'm lifting those, I'm going to identify the location of the wound, the type of wound it is, the odor that's coming from the drainage of the wound, and also I'm going to note the number of gauzes that was saturated by the wound. That way I know how many to put back on. And for this patient, it was 2, but even though it's stuck there. So I'm going to go ahead and I'm going to dispose of my gauzes. Put them right there. And I'm also noting the color of the wound, the consistency of it, the odor, the amount of drainage, and the approximation of the edges of the wound. And I'm going to go and I'm going to wash my hands after I dispose of those clean gloves. And now I'm ready to begin my sterile procedure. I'm going to start by opening each of these packets. So I'm going to reach and pull back. And I'm careful not to cross back over the gauze because that would be considered contamination. So when I open, I'm coming to the side. And I'm also, when I'm peeling back, I'm grabbing the edges. And then I'm going to pull this. I'm going to take my sterile water and I'm going to cup it or grab it by the label. And if this is old, I would go ahead and lip it. Like if it was already used, I would go ahead and lip it to my biohazard bag, but actually I crossed over my sterile field, so that would be considered contamination. So I'd go ahead and lip it, pull it back, and then I would apply sterile water to that set of gauzes and this set of gauzes. And then I would put that right back there. And then now I'm ready to begin to put on my gloves. I would open this. Dispose of this trash. I would also be careful not to ever turn my back to my sterile field. grab the inside of this glove and I would insert my hand, being careful not to touch the outside of the glove. And then I would take these 2 fingers and I would insert them into the edge of the glove, not touching the inside of the glove, like that. And I would insert my hand again. Now I have my gloves on. I'm gonna do this to get that out of the way. And now I'm ready to begin cleaning my wound. So I would take these gauze, come over here, Angel. I would rinse them out, bring them over here, and I would clean the middle. You start from cleaning the inside out of a wound, and I would go along the middle and go to the bottom, and then I'll take this. I would come around, and I would clean from the inside out, and I would be careful not to cross over what I've already cleaned because that would be considered contamination. And I believe that my glove just touched the inside of that biohazard bag, so that would also be considered contamination. Come back. Then I would clean the outside closest to me. Dispose of that. And this gauze could be used if there was any extra material or matter that I needed to get rid of, but there's not, so I'm going to go ahead and get rid of that as well. These 2 are my dry gauzes. I would separate them, and I would lay it just like that. Then I would grab my ABD pad, and I would, like that, lay it. Now my sterile procedure is over, and I can go ahead and get rid of my gloves. Now I can go ahead and start taping. And when I apply the tape, I'm just going to go along the outside of the dressing. That's too short. I thought I was doing it outside edge again. And now I could take this and I would write my initials, the date that it is, which is 10/4, and I would also write the time, which is 2:30, and I would apply it to the edge of the dressing, and that way that would help the next nurse know that that was the last time that it was changed, the dressing was changed. I would dispose of all of this into my biohazard bag, and when exiting the room, I would clean up the table, wipe it down because it was a sterile procedure, and then I would dispose of my biohazard bag, and I would wash my hands. Alright, now that all my procedures are over with, I would go ahead and I would put both of my patients' side rails up ×2. That just decreases any accidents that might happen. I would make sure that my patient's call light is in reach, which it is, and that would be so she could call me anytime that she needed something. I would also make sure that her bed is in the lowest position, and it is. Then next I would go and wash my hands. I would dispose of any biohazard material that's in her bag, so anything that I needed to get out of the room. I would document everything that occurred throughout the day, and I would also report any abnormalities, but there were none, so everything is good.